We were looking for things that could be done that might radically alter rural health, and we thought if we could get technology to them, that would be a significant help. And we chose surgery because surgery carries with it a whole range of skills that we thought would be useful for little hospitals, and there was a big need in communities to have surgery. We went around all the small communities, most of whom had lost their operating theatres in their hospitals, quite rightly so, up to even 15 years before. But they were very keen to establish surgery again with this technique of sharing. None of them could afford their own operating theatre or afford to even run their own operating theatre, but they could all have as much surgery as they could cope with if they shared the resource, and that was a mobile operating theatre. Well, a typical day in the bus starts actually the night before, because it moves in from the town that it's been the day before operating, often arriving between sort of 10 o'clock in the evening and maybe 1 o'clock in the morning.
So we will pick it up, say here like at Amberley, do the day's operations, travel down the roads. Once we get down there, we'll set it up, so it's ready for the crew in the morning. So we'll do the basic setup, and the crew come in, they do their setup, do their operations.
And then it sits there for the night, and the staff who have also arrived the night before, but a little bit earlier than that, they start up at about 7:30 in the morning, come down to the bus, get it going. Of course, its environment control systems will be running all night, so it's usually warm and comfortable when they get in. And then the first patient usually starts about 8:30. Those patients have been booked in before from a central listing office.
Divide the pouch and tuck the rest in.
Oh, yeah.
But as long as it's all tightened up so it's not going to...
So how did it fall out anyway?
Well, because the little muscle shutter in the ear is stretched.
The surgeon will arrive that morning from the nearest regional centre, same with the anaesthetist.
Boss is going to give you some oxygen now. Nice and neat, just going to give you some oxygen, get rid of that nasty carbon monoxide from the cigarette, eh? You be really careful after when you have a cigarette, you might blow your head off, okay? Big breaths. You start to get tired now. Just let yourself relax as long as you can bear it. Just keep doing those nice, big, slow breaths.
Local nurses have been trained up, and they perform the bulk of the nursing on the bus. 2 in the operating theatre, 2 in recovery, and they're hosted by one of our clinical nurse leaders who is also involved in their continuing and ongoing training.
Rural nurses traditionally do a lot of things like sporting injuries or deal with car accidents, so the skills that they learn here with our theatre means that they can transfer those to the unconscious patient upside down in a ditch. So learning to maintain an airway on an unconscious patient, in their medical practice probably not a great deal of use, but in the emergency situation it's fantastic.
The scale of operations is largely limited by the hospital that we're attached to. If we're attached to a big hospital, we can do operations of any size. If we're attached to a little hospital and the surgeon's only going to be there for the day, then we're very cautious about doing things that might cause problems afterwards. So generally we look for relatively straightforward day surgical cases to do. Patients, of course, are much more comfortable at their local hospital where they know a lot of the people, and they feel a lot safer knowing that they're being treated as well as you can be treated, but most importantly, it's in their own community.
With the surgical bus, what happens now is that people come here, they have their pre-admission locally, which is only a short sort of period, and then they have their surgery, and then the following, after 4 hours of recovery, they go home. So it's a very simplified process for them. Surgery is a series of events before you actually get to the theatre for your operation. It requires pre-admission assessment clinic, and before the patient has to travel for that, and then they have to come back to Oamaru. And then on the day of surgery, they have to be there. Of course, family has to be there too. And in many cases, they have to stay overnight or 2, depending on how they are in their recovery. And so it takes a lot of time off families and, of course, resources.
Patient, when they've had their operation, go into the recovery area that's been set aside in the hospital. Now, they didn't have recovery rooms, so we convert a room into the recovery room, and we provide all the recovery electronics and stuff, and then there's communications devices that we set up, radio links with the bus from recovery, so if there's any problem, they can call the bus immediately.
So the funding for our unit comes from the Ministry of Health. So we've got a contract with the Ministry of Health for 5 years, and the purpose is for us to go out and do surgery in rural areas and assist the district health boards.
The DHBs didn't exist when we started off, and little hospitals were sort of on their own. And then they came in to try and integrate the care. In fairness to the rural communities, I think the DHBs generally are reluctant supporters of rural health. And for a little hospital, the difficulty is, do you stir the sleeping giant, or do you just try and be good and kind of get looked after? And I can tell you, you have to stir the sleeping giant. It's the only way to secure, in a fight for money, it's the only way to do it.
So if you look at capital equipment cost of building a new theatre, it's about $2 million. And many of these places that we go to used to have theatres, or to rebuild that again will cost about $2 million. So you times that by the 22 locations we go to, and there's a rude number of $44 million worth of savings just by sharing equipment.
Well, the purpose of the bus is perhaps to deliver one of the stated government goals, which is that rural people should have equal access to healthcare to their city counterparts. And this doesn't address all healthcare, but certainly addresses one component of it, the day surgical component of it. And so the bus is about doing that. And the second thing the bus does is about showing small communities, who in many ways know it already, that if you just put your mind to it, almost anything's possible. We see a great future for rural medicine. We see some problems in city medicine actually that might drive people into rural in the future. But the thing that rural has to do, and they're working towards it, is to get around what's called the tyranny of time and distance. And most things result from that if you're living in rural. Now, video communication is one of the things that will alter that. Being able to get expensive resources by sharing them in this way, mobile, and we can think of all sorts of other things they could share, and even small items can be shared between communities. So we think there are solutions right there for rural communities to unabashedly go into the future successfully.